Hi, I'm John Keogh. I'm one of the specialist obstetricians and gynaecologists at the SAN Hospital, and we're talking a little bit about antenatal education. And one of the things people sometimes ask me about when they're talking about delivery is what sort of delivery I really want them to have. And I'm saying, look, I don't really care. I may not be very politically correct, but to me, that's not the most important thing. My most important thing is that you walk out of this hospital feeling empowered, carrying your baby in your arms and saying, yep, that was a good experience. I'm happy with the way that went. And I felt that I was involved, and that in all the decisions that we made together, we made them together for the benefit of myself and my baby. That's what I want for you. So part of that is for you to be as informed as possible before you get into the situation of labour. And antenatal education is a pathway, it's part of the pathway to that. Part of the pathway is what we discuss in the rooms and how we see the baby growing and what we find out about the baby as it develops. And part of it is how you arm yourself so that when it comes down to the birth, you are as prepared as you can possibly be. Because birthing is a little bit like the first step of parenting, you know? You think it's going to go one way and all of a sudden takes a bit of a turn. And where people run into trouble is where their understanding of things is so rigid that they can't duck and weave. And I often say to people that birthing is like the first experience of parenting. You think your son's going to play football, but all he wants to do is dance. What are you going to do? You're going to have to change your view. You can't just send him out on the field in the football boots because he won't be playing football, you know? He'll be doing the dance. So I say that you've got to be prepared to be flexible, and therefore you've got to know what the range of circumstances you might meet are. So antenatal education gives you information about what might come up, about strategies that might be employed to handle those situations as they come. They let you know that not everything that changes from your preconceived course is abnormal, that not all delays are unacceptable, that sometimes you may have to jump into things, but sometimes just waiting, masterly inactivity might be the best approach. So it gives you knowledge in which you can interpret the things that happen as you go through labour. But antenatal education, of course, is wider than that, because labour is just the door you go through to get into being a parent. And of course, that's just one day, but parenting lasts for 50 years. You tend to take this child home and love it for 50 years. So those first few months, they're a little bit disorientating for a lot of people because this is a brand new experience. And even if you've done it before, it's still a brand new experience because this is a different child. So what we also want to do with antenatal education is get people as comfortable as possible with the things they might meet in those first initial weeks, with breastfeeding, with settling, with what to expect of a new baby, how they behave, because, you know, they're challenging, and you're tired, and, you know, sometimes you can't understand what the baby is on about. So all those things about how to look after a baby, how to settle a baby, they're an important part of antenatal education. One of the things that can really get in the way of people in labour is fear. And fear often comes from not knowing what might happen. Most people are not afraid of the things they know could happen, but the things they don't understand that might happen. So if people know this could happen, but there's a strategy, this could happen, but there's a strategy, they're less worried about that. It's the unknown that worries them. And we know for a fact that actually the more afraid people are, the more likely they are for their contractions not to work well in opening up the cervix. So if you look for the top 10 causes of why labour doesn't progress, causes 1 to 7.5 are all what they call inefficient uterine action, where there's the uterus is contracting but not getting very far. 7.5 to 9.5 would be posterior position of the head. 9.5 to 10 would be maybe the head's too big for the pelvis, but that's rare. So we look at those things that might create a way of getting rid of those first top 7.5, the inefficient uterine action. And antenatal education is right up there in that. Other things like having a dedicated carer, a midwife who's with you in the room, good pain relief, early intervention for when patterns become abnormal, like using maybe the drip to help the contractions coordinate themselves, or maybe breaking the waters if you're not progressing to help the uterus coordinate their contractions. They're all good things. But antenatal education, walking into that room with confidence, that is 80% of the battle won. So if I see someone coming in, they're tense, they're anxious, they're worried, my first job is to try and reassure them that they're safe, that we're going to be looking after them, that they're in a safe environment, that we're listening to them, and that we're going to work together to make sure that at the end of this, everything goes well. I would rather not be in that situation in labour ward. I'd rather address those issues all antenatally, through the rooms, through antenatal education. And so people come back from the antenatal classes, and then they come with their list of questions, and we go over those things that they've identified that are important questions for them.